Lastly, we'll finish up by talking about a graph that I remember being particularly difficult to understand the first time I saw it. And it's a graph that demonstrates the static compliance of the chest wall and the static compliance of the lungs, and then demonstrates the total respiratory system compliance and the relationship between the chest wall and lungs. So on your y-axis, I would draw the percent of vital capacity, and I would also put a volume in mil per kilo for residual volume, functional residual capacity, your tidal volume, and your total lung capacity. Then on the x-axis, I would do in centimeters of water your recoil pressure. And the key points I'd probably put here is that on either side of 0, which I'd place in the middle, I would have -5 on the left and +5 on the right. And then I would go up in increments of 5 from there to probably a max of -20 on the left and a max of around 30 on the right. So in purple, we'll draw our chest wall recoil, and in blue, we'll draw our lung recoil, and then in red, we'll draw our total respiratory compliance recoil. And essentially, for our chest wall, we'll start at about -20 at your residual volume, and then it will gradually go up, and at FRC, it should cross at about -5 centimeters of water. And then it would cross the 0 line at around 80% of your vital capacity here. And then it will just slightly go positive as it reaches 100%. Now, chest wall recoil pressure is your pleural pressure minus your atmospheric pressure. Your pleural pressure is also your intrathoracic pressure essentially. And it's generally at FRC, -5 centimeters of water, which is why it crosses the point here. But if you wanted to calculate it, we would need to convert our atmosphere, which we usually talk about in 760 millimeters of mercury at sea level, into centimeters of water, which is about 1,033 centimeters of water. And then if we do the calculation and we say, okay, it's normally -5, then we know that it's normally -5 centimeters of water compared to atmosphere. So essentially it ends up being 1,028 centimeters of water, which is atmosphere minus 5 centimeters of water. And then you minus the atmosphere, which is 1,033 centimeters of water, and it'll equal -5 centimeters of water. And that gives us that equation, chest wall recoil pressure equals pleural pressure minus atmospheric pressure. And then you would be able to calculate this throughout if you had an esophageal manometer and you were getting the patient to, at different lung volumes, hold their breath with their glottis open and letting all airflow stop, and then you would just minus your atmospheric pressure off. For your lung recoil pressure, this is also your transpulmonary pressure, and this is your alveolar pressure minus your pleural pressure. So alveolar pressure with an open mouth and open glottis at rest should equal atmospheric pressure. So therefore, we already know atmospheric pressure was 1,033 centimeters of water, and we said in our previous equation that our pleural pressure or our intrathoracic pressure was 1,028 centimeters of water. So therefore you just do 1,033 minus 1,028, which equals +5 centimeters of water. And that explains why at FRC, your lung compliance crosses at 5 centimeters of water. Now the lung compliance curve is a little bit different in that as it goes down from this point, it will never really cross the 0 mark, at least not in healthy lungs. And it will actually go below your residual volume, which is where the chest wall can't go lower than this. And this is because the lungs can collapse further than what the chest wall would normally allow them to. And we know this because when someone has a pneumothorax or one lung ventilation, the lung will collapse smaller and there will be air within the intrathoracic or the intrapleural space. Now, as we extend up from the FRC at 5 centimeters of water, the lungs are quite steep in terms of their compliance here, and then they will gradually bend to the right as it reaches the extremes. And this represents that at the extremes of lung volumes, the compliance dramatically drops as you need increasing pressure to be able to increase the volume of the lungs, which is what we expect anyway. Now, the chest wall recoil pressure and the lung recoil pressure, to figure out out their recoil pressures, you're just trying to figure out the pressure gradients between either side of what you're measuring. So for the chest wall, if you look at this diagram here, we just want to know that pleural pressure and then the atmospheric pressures on the outside. For the lung recoil pressure, you want to know what's happening within the lung parenchyma. So you go to the alveolar pressure and the intrapleural pressure. And that's what gives you the recoil pressures, is that driving gradient between those two pressures. Now, these pressures will change throughout breathing, and you can demonstrate this here when you graph out the pressures during inspiration and expiration. And you can see here that the max transpulmonary pressure gradient is at the end of inspiration, which makes sense as the lungs are pulling harder inwards against the intrathoracic pressure, which is more negative to hold the lungs to the thoracic cage to keep them expanded. And that again demonstrates why at extremes of lung volume, the compliance drops off, because you need more pressure for the same amount of volume. Total compliance is just in series with chest wall and lung compliance, so they're just additive. If you take your FRC, you're going to have your chest wall compliance, which is going to be -5 centimeters of water, and then you're going to plus your 5 centimeters of water for your lung compliance, which equals 0. So your first point is that your total respiratory compliance will sit at the 0 mark. As lung volumes decrease, the compliance will gradually go down and it will shift more towards the chest wall compliance and eventually meet chest wall compliance at the residual volume. And this is because at this level, the chest wall compliance dominates compared to the lung compliance. And this is because the closer the lung compliance gets to 0, the less it can influence the chest wall compliance, because as the lung compliance approaches 0, then it ends up becoming an equation where it's whatever the chest wall compliance is plus 0 of the lung compliance. The total compliance will then essentially be in between the chest wall compliance and the lung compliance, and it will gradually increase beyond this FRC point where it equals 0. But then you will notice there's a point where the chest wall compliance crosses 0 centimeters of water. And it's at this point that the total respiratory compliance also crosses the lung compliance. And the reason it crosses here is because, again, because of the fact that chest wall compliance plus your lung compliance equals your total respiratory compliance, your chest wall compliance has become positive here. So it's a positive plus a positive. So now your total compliance must be greater than all the compliances there. At this level, the reason that the chest wall becomes positive is because of the fact that the recoil pressure of the chest wall now favors inward recoil, because you have your muscles that are pulling out on the chest wall and deforming the chest for inspiration. But now the chest wall naturally wants to spring back inwards rather than be springing outwards. And this is in favor with the lungs trying to spring inwards as well. It's also worth pointing out that the chest wall is the limiting factor for the residual volume, as the thoracic cage can't reduce its volume less than this due to the bony structures, but the lungs can actually reduce further to a minimum volume. And we know this as when there is a hole in the chest wall and a pneumothorax forms, then the lungs will collapse even smaller, and this also happens with one lung ventilation. The last point I wanted to show in this graph is that you can also demonstrate dynamic compliance within this graph. It's not specifically meant for that, but dynamic compliance sits within this range between your FRC and your tidal volume here. And it represents your inspiratory and expiratory phase, which you can draw within here. And if you zoom in, it'll look almost exactly like your dynamic compliance graphs that you would draw anyway. So that brings us to the end of this video. We talked about compliance and the fact that it's your volume change divided by your pressure change. And high compliance means that you can increase the volume for lower pressures, and lower compliance means that it takes more pressure to get the same amount of volume. This also helps us explain hysteresis as well, and time constants within the lungs that affect your dynamic compliance, while static compliance is when there's no airflow. So hopefully that makes respiratory compliance much clearer. If this video helped, feel free to let me know in the comments. If there's anything you want me to cover, anything that I need to correct, feel free to leave it in the comments. And thank you for watching.